I'm joined by Dr. Balwir Matharu-Ball, who is the Director of Biobank. How are you?
I'm very well, thank you. How are you doing?
I'm really well. Are you enjoying Arab Health so far?
I think it's been a wonderful event for healthcare, for G42, and for the Biobank, and for all the Omics that we offer. Absolutely. We've had lots and lots of delegates coming to the stand, asking questions, which is exactly what we want to do.
Yeah, there's lots of excitement here on the G42 stand.
Absolutely, and the fact that we actually signed with SomaLogic to bring on another omics as a proteomics on board is absolutely superb for G42 and healthcare.
So tell us, what is a biobank?
Okay, so a biobank is actually a facility that collects samples and data from patients after they have been consented. So the samples and data actually contribute to research, both for academics, for pharma companies, and for clinical trials units as well. And what we do is, once you've consented a patient in a clinic, what we do is we actually go to the physicians and ask them if we can collect either blood samples, tissues, urine, depending on what research is being carried out and what's important. Now, with the sample comes the data for the sample itself, plus the patient. What test did they have done? What was the outcome of the test? What drugs were they given? And this makes it really important for research purposes, because samples without the data does not mean anything. And so so biobanking is supporting research efforts across the board.
And who accesses the samples and the data?
So first and foremost, samples and data are actually accessible to academics. It could be in universities, it can also be, as I said, pharma companies, and also for clinical research units as well. And they use these samples and data to look at markers for diagnostic, for example, better treatments. They will look for new drug targets as well. And so this is really, really important effort to make sure that biobanks actually support what's called translational and personalized medicine. Personalized medicine means that what we want to develop better treatments for the patient, for the disease they have, and not to plug everybody into the same pigeonhole to have the same treatment, which actually gives them really adverse reactions to the drugs or the treatments. It costs money to healthcare. So we want to give the patient the right treatment at the right time for the right disease, for their disease. And so this is really, really important for healthcare, especially what G42 is trying to aspire to.
And what other data do you add to the biobank?
So the samples that we release, we expect once everybody's manipulated and published their data or any intellectual property, we expect them to return the data. The data could be omics. Omics meaning next generation sequencing, which actually looks at the patient's DNA, the hereditary part, and actually looks at all of the genes that patient could be susceptible to disease-wise and lifestyle. And also proteomics. Proteomics is the markers that circulate, the proteins that circulate in the blood. And some of these proteins could be either high or low, depending on the disease that you may have. So this gives you an idea the lifestyle and the disease a patient has, and that way you can actually use these markers collectively, both together with all the other data that you've collected, to actually give the patient a better outcome for their disease or lifestyle, and actually prevent disease as well. So this is really, really important for future healthcare here in Abu Dhabi and United Arab Emirates as well.
And when does a biobank become a data bank?
So initially, like I said, the samples are important, but as we accumulate more omics data, the biobank data, which, as I mentioned, which is the patient journey and the sample data, you collect all these, put all these together, and when pharma companies want them, they want to look at what insights that give them, like, as I mentioned, new drug treatments, but also if a patient's been given a particular drug, what was the outcome for that patient? Were they cured? Did they react in a way, or did they not react positively to that disease? And this way, you become a data bank, which is so, so crucial. Data banks become important across for academics as well and for clinical trials as well. So Biobank, G42 Biobank, aspiring to do this and make it a better health care, not a sick care, because that's what we want. We want to have a better health care. So that's what a biobank does.
I love that, healthcare as opposed to sick care.
Yes, absolutely. We want healthcare. We want preventive. We want personalised medicine. We want stratification so that patients actually can go to the different streams of a drug and not be put through the same drug and have some will respond and some won't, and have all those horrid side effects that every patient suffers from currently. So this is where the Abu Dhabi wonderful Department of Health, the Executive Office, G42 and the Biobank are collectively working toward to improve this healthcare.
Amazing. Thank you so much for your time.
Thank you very much.